Hi, thanks for joining us. You're watching Health Matters. I'm Renee Rouse with the Florida Department of Health in Martin County. Our mission for this show is to give you important and urgent information that affects the health and safety of you and your family. Living in Martin County, you may see all the mansions, country clubs, and golf courses and think about all the wealth on the Treasure Coast. But not everyone is so fortunate. As a matter of fact, according to the United Way, 45% of households in Florida struggle to afford basic household necessities. Many of our families, neighbors, and colleagues have jobs, work hard, and earn above the federal poverty level, but still don't have enough income to make ends meet. In this episode's Big Story, we'll visit with one local group determined to help struggling people and families in Martin County. For many of us adults, brushing our teeth is just part of the routine when we wake up in the morning and something we do right before bed. But for children, it can be much more difficult. And without daily brushing, a child's teeth can start to decay, and that can cause many health problems. In this episode's Health Spotlight, we visit with the Department of Health in Martin County and show some of the great work the staff is doing to get kids to brush early and often. And finally, it's that time of year again, flu season. Both kids and adults are coming home from school and work with runny noses and sore throats. In our health calendar segment, we'll share with you the best tips to stay healthy this winter and shoo the flu. But first up is our big story. You've heard the term the working poor. There are many people in our area that have jobs but are living paycheck to paycheck, struggling to pay for essential items. Thankfully, there are many places to turn to for help in Martin County. Bob Hoganson sat down with one family that is grateful for the help that one local nonprofit provides to them.
So, bread.
Shannon Bell Mayhew and her daughter Gabby are grocery shopping.
You want cereal? One cereal.
But it's not exactly what it seems.
And if it weren't for House of Hope, I wouldn't have food in my house.
Gabby and her mom Shannon are at the House of Hope's food pantry in South Stuart. They can go once a week for bread and produce, but only once a month for everything else.
We stretch it. A lot of canned goods, a lot of pasta.
Shannon works full-time, has for the last 9 years. But after paying rent, utilities, health insurance, car insurance, and a phone bill, there's just nothing left.
Which leaves very limited, very, very limited funds for food and clothing and the everyday necessities that you need. It's very hard.
Shannon is who you would call the working poor. Full-time, 40-hour-a-week worker, making too much for food stamps, but not enough for food. The United Way has classified her and about 2 million other people in Florida as an ALICE household. ALICE standing for Asset Limited, Income Constrained, Employed.
They're your neighbors. It's people that who work at the supermarkets, in the retail industry, in the hospitality industry.
Leslie Frederick is the program manager for the House of Hope. Many know the nonprofit for its popular food drive that happens every year, sending much of that food to its food pantry. Through donations and fundraising, the House of Hope is able to offer many other services to Martin County's poor, including a clothes closet, case management, financial assistance, and information referrals. More than 5,000 people a month are touched by one of these services.
Most of our community knows us about our food pantry. For us, food is the portal. So if somebody's coming for help with food, there's probably some other resource that we either internally have where we could connect them.
Leslie says that there are two major forces in South Florida and the Treasure Coast that make it difficult for the underemployed to make ends meet. One, we have a large service-related industry, particularly affected by the seasonal changes in our residents.
When our friends go up north, those people are still here, and they need, when money goes with them, and they need to figure out how they're going to manage their daily lives. And
two, high housing costs.
It's determinations of families have to figure out, I'm paying my rent, but I only have $50, $100 left for food, or this medical expense.
And that's where the House of Hope comes in, helping families in need as a diverse community resource.
Kids that eat family meals together are much more likely to eat healthfully,
even holding a wide range of events and classes at the newly renovated Golden Gate Center for Enrichment. Opened in the summer of 2017, the Neighborhood Center offers everything from computer classes to free immunizations and STD testing, family planning,
So we're going to be making a cabbage salad.
to this recent cooking and nutrition workshop provided by the Florida Department of Health.
We're also in that process of trying to empower our clients so that they don't necessarily need to come to us every month, that we're trying to connect them to resources.
Here, sausage.
For Shannon Bell Mayhew, she says it was tough to reach out for help in the first place. Her pride didn't allow her to ask for a handout. But without the House of Hope, her and Gabby say they probably would have been evicted, or worse.
I didn't even know about House of Hope until somebody told me about it. And I'm glad I found out about it. But don't be ashamed.
If you would like more information about what's going on at the Golden Gate Center for Enrichment, or if you would like to volunteer, donate, or search for services at the House of Hope, you can go to their website at hohmartin.org, or you can call at 772-286-4673.
Everyone has their favorite candy, but if that sugar is not brushed away, it will break down the enamel and lead to tooth decay. Children and adults need to brush their teeth daily to protect against those sugars. In this Health Spotlight segment, Bob Hoganson tags along with staff from the Florida Department of Health in Martin County as they evaluate children's teeth after beginning a toothbrushing program at a daycare center in Stuart.
Up like the sun, down like the rain.
At Gertrude Walden Daycare Center in Stuart, there's something to smile about.
I'm a dentist, you see, to take care of their teeth.
The Florida Department of Health in Martin County is partnering with the daycare center to educate these youngsters and their parents about good toothbrushing habits.
And we noticed that many of the kindergarten children either had quite a bit of untreated decay or have had a lot of dental work done.
In August, the health department began a pilot program at this daycare, getting kids to brush their teeth every day after lunch.
So we want to focus on the younger groups, your 2 and 3 and 4-year-olds, before they get to kindergarten.
Now, 3 months later, health officials are back evaluating the kids.
If we can establish good behavior and good oral hygiene at a young age, they should be able to carry it on in the grade school level.
Having healthy teeth as a child can go far in keeping kids in class, alert, and paying attention.
They're missing school, their attention span is not what it should be, they're in pain.
The health department's dental hygienist, Millie Ruiz, says that unfortunately, for many of these children, this may be the only time of the day that they do brush their teeth.
Open real wide.
And Miss Millie, as the kids affectionately call her, says that poor oral hygiene can leave more than a bad taste in your mouth.
Children, when they don't brush, all those sugary substance in the food they eat actually starts eating away on the enamel.
And that can lead to tooth decay. This program at the daycare is aimed at preventing that. The program is an extension of the school-based dental sealant program, where Millie and her colleague Michelle travel to various schools to examine kids' teeth. If the teeth are healthy, she will apply a sealant to protect them. That program is funded in part by the Children's Services Council of Martin County and is offered free to children in all Martin County schools.
Oh, you love Mr. Brushy.
And as for those kids at the daycare,
They walk in the morning and say, Miss Washington, the first thing I did was brush my teeth. Look.
Thelma Washington is the executive director of the Child Care Center. She says the program is working.
They're excited about it, and as soon as they finish breakfast, they want to brush them. As soon as they finish lunch, they want to brush them. So now they just want to brush them all the time.
To change habit and change behavior. If we can do that in the school and take it on into home, we're kind of establishing what we wanted to do.
Thanks, Bob. Let's hope all those kids carry on with those good teeth brushing habits. And finally today, it's that time of year when all the germs seem to be spreading around. You may be calling in sick to work to take care of yourself or your sick kids. Flu season is upon us, but that doesn't mean you should lock yourself up in your house and not come out until spring. There are a few things you can do to protect yourself and others from getting the flu. We all know that the flu can make you feel terrible. Symptoms come on quickly and can include high fever, body aches, runny nose, and sore throat. Only a doctor can diagnose if you have the flu, as many of these symptoms can come from a viral infection as well. The flu is particularly dangerous for young children, pregnant women, and adults over 65, and anyone with a compromised immune system. It's best to protect yourself and others by washing your hands frequently, covering up coughs and sneezes, eating nutritious foods, exercising, and getting a flu shot. The flu vaccine is available at your doctor's office and local pharmacies. The CDC recommends that everyone over the age of 6 months get vaccinated. However, this year, the nasal spray vaccine is no longer recommended. The health department is offering free clings with flu prevention information. The clings stick to mirrors or glass and are a friendly reminder on how to shoo the flu this season. If you would like some free clings or any other information about the health department, go to our website at www.martincountyhealth.com or call the health department at 772-221-4000. And before we go, I also wanted to mention that we have a new Twitter page. Follow us at Go Healthy Martin on Twitter for up-to-date public health information and healthy lifestyle events that are going on around the county. Well, that wraps up this episode of Health Matters. I'd like to thank the House of Hope and all the volunteers that make this community so great for all of us. I'm Renee Rouse. Thanks for watching.